Your cat is eating more than ever. You refilled the bowl twice this week. She seems energetic, maybe even more than usual. Curious. You think, good, she is healthy, she has a great appetite. But here is what you do not know. That picture, the one that looks like health, can be the opening scene of a serious hormonal disease that is quietly burning through her body from the inside. Concerned. And by the time most owners figure out what is actually happening, the cat has already lost a dangerous amount of weight. Her heart is under strain, and the window for the easiest treatment has narrowed. 1 in 10 cats over the age of 10 develops hyperthyroidism. That number climbs higher as they get older. And the cruelest part of this condition is that it disguises itself as vitality. By the end of this video, you will know exactly what is happening inside your cat's body, what to look for before the obvious signs appear, and what questions to bring to your veterinarian. Before we go any further, I want to be straight with you. My name is Dr. Amal. I have spent 25 years working with animals in clinical settings, in emergency rooms, and in the kind of farm environments where you learn to read an animal fast, because there is no time for guessing. What I share in these videos comes from clinical research and direct experience. It is educational. It is not a diagnosis. Your cat is an individual, and her situation is unique to her. Take what you learn here into a real conversation with your own veterinarian. That is exactly how this information is meant to be used. Now, let us get into this. I am Dr. Amal. In 25 years of practice, I have seen hyperthyroidism in cats go undetected for months, sometimes over a year, because the early signs read as normal aging or even as improvement. I have seen cats come in for a routine visit and leave with a diagnosis that the owner had no idea was coming. I have also seen cats caught early, treated effectively, and go on to live comfortably for years. The difference between those two outcomes almost always comes down to one thing: how informed the owner was. That is what today is about. Hyperthyroidism is now the most commonly diagnosed hormonal disorder in older cats. We are not talking about a rare condition. We are talking about something your senior cat has a meaningful statistical chance of developing. Studies published in veterinary internal medicine literature put the prevalence at roughly 10% in cats 10 years of age and older. Other research suggests the rate may be even higher in cats 12 and above. For context, if you walked into a room with 10 senior cats, statistically, at least one of them has this condition right now. What most owners get wrong is the direction of the symptoms. We expect sick animals to slow down, to eat less, to become withdrawn. Hyperthyroidism does the opposite at first. The cat becomes more active, hungrier, sometimes more vocal at night. Owners interpret this as a good sign. That misread costs time. And in this condition, time matters. Here is the analogy that makes this click for most people. Imagine someone floored the accelerator in your car and then removed your ability to brake. The engine is running at full throttle. That is what hyperthyroidism does to your cat's metabolism. Everything is running too fast, and the body pays the price for it. The condition starts in the thyroid gland. Your cat has 2 of them, sitting on either side of the trachea in the neck. Under normal circumstances, these glands produce thyroid hormone, specifically thyroxine, or T4, in carefully regulated amounts. Thyroid hormone controls metabolism. It sets the pace for how fast the body burns energy, how the heart beats, how the gut moves, how the kidneys filter. It is a master regulator. In hyperthyroidism, one or both thyroid glands develop a benign, meaning non-cancerous, growth called an adenoma. In over 95% of cases, this growth is benign. But benign does not mean harmless. This growth functions outside of the body's normal feedback system. It produces thyroid hormone continuously, regardless of what the body actually needs. The pituitary gland, which normally tells the thyroid to slow down when hormone levels are high enough, sends the signal "Lee," and the adenoma ignores it. The result is a sustained hormonal flood. T4 levels in the bloodstream climb well above normal, and every system in the body responds. The heart is particularly vulnerable. Elevated thyroid hormone causes the heart to beat faster and with more force. Over time, the heart muscle thickens, a condition called hypertrophic cardiomyopathy, as it tries to compensate for the constant demand. Research indicates that a significant percentage of hyperthyroid cats have measurable cardiac changes by the time of diagnosis. In about 2 minutes, I am going to walk you through the specific signs that tell you this condition has moved from early stage to something that requires urgent attention. Stay with me. The kidneys are the other organ that carries a heavy burden in hyperthyroid cats, and this is where the condition gets complicated in a way that most owners, and even some vets, need to think through carefully. Because elevated thyroid hormone artificially boosts blood flow to the kidneys, it can actually mask underlying kidney disease. The kidneys appear to be functioning normally on blood work, while the thyroid is overactive. When the thyroid is treated and hormone levels normalize, blood flow to the kidneys drops back to its actual baseline. And sometimes that is when underlying kidney insufficiency becomes visible. This is not a reason to avoid treatment. It is a reason for close monitoring after treatment begins. Your veterinarian will want to recheck kidney values after any thyroid intervention, and that is exactly the right approach. Now, the warning signs. The early stage of hyperthyroidism looks like this. Your cat is eating well, maybe too well. She finishes her food and wants more. She seems restless, more active than she has been in years. She may be vocalizing at night, yowling or crying in a way that is new. Her coat may start to look slightly unkempt, not dramatically, just a little rougher than usual. These signs are easy to miss or explain away. The transition into a more advanced stage is where the picture becomes clearer and more serious. Weight loss, despite a strong appetite, is the clinical hallmark of this condition. The metabolism is burning calories faster than the cat can consume them. The muscle over the spine and hindquarters is the first to go. Run your fingers down your cat's back. If the vertebrae feel prominent, if there is little muscle cushioning them, that is a sign worth acting on. Not tomorrow, this week. Other signs in a more advanced presentation include increased thirst and urination, vomiting, diarrhea, rapid breathing, and a heart rate that feels elevated even when the cat is resting. If your cat is showing rapid or labored breathing, or if she seems suddenly weak or collapses, that is same-day emergency care. No waiting, no watching to see if it improves. The heart and the lungs are under direct strain at that point. Catch it at the earlier stage, the increased appetite, the weight loss, the unkempt coat, and your treatment options are broader, your outcomes are better, and your cat avoids the cardiac complications entirely. Now let us talk about what most owners do wrong with this condition, because this is where I want you to be honest with yourself. The first mistake is waiting for the cat to slow down. Owners expect illness to look like lethargy, and with hyperthyroidism, it does not early. The second mistake is attributing the weight loss to age. She is just getting older. Older cats get thinner. That is true to a degree, but muscle wasting in a cat that is still eating well is not normal aging. That is a signal. The third mistake, and this one genuinely surprises people, is avoiding the vet because the cat seems okay. She is eating, she is moving around, she seems fine. That active presentation is exactly what makes this condition dangerous, because it buys the disease time. The fourth mistake is skipping the annual blood work for senior cats. A standard senior blood panel will catch elevated T4 levels. That one test, done at a routine visit, is the most reliable early detection tool we have. If your cat is over 10 and has not had blood work in the past year, that is the first call you make after this video. Here is what you do right now. First, look at your cat's body condition today. Place your hands on either side of her spine. You should be able to feel the vertebrae, but they should not feel sharp or prominent. If they do, write that down and mention it at your next vet visit. Second, track her food intake for 1 week. Note how much she is eating and whether her body weight appears to be holding. You do not need a scale to notice that your cat is looking thinner. Third, Note any nighttime vocalization. Cats with hyperthyroidism often become more vocal at night due to the neurological effects of elevated thyroid hormone. If this is new behavior, it belongs in your notes. Fourth, schedule a senior wellness exam if your cat is 10 or older and has not had one in the past 12 months. Ask your veterinarian specifically about a senior blood panel that includes a T4 measurement. Say those words, "I would like a T4 checked." Some standard panels include it, some do not. Ask. Fifth, if your cat is diagnosed with hyperthyroidism, ask your vet to explain all 4 treatment options: medication, dietary management, radioactive iodine therapy, and surgery. Each has a different profile in terms of commitment, cost, and outcome. Understand what you are choosing between. Sixth, after treatment begins, ask specifically about kidney monitoring. Given the relationship between thyroid hormone and kidney blood flow, follow-up blood work for kidney values is a standard part of responsible post-treatment management. Here is what I want you to leave with. Hyperthyroidism is common in senior cats. It does not look like sickness at first. It looks like energy and appetite. That is the trap. The clinical hallmark is weight loss despite eating well, and if you are seeing that in a cat over 10, that is a veterinary visit, not a wait and see. The condition is treatable, genuinely treatable, with good outcomes when caught before serious cardiac or kidney involvement. And a single blood test, added to a routine senior exam, is all it takes to detect it. Get the blood work. Know your cat's T4. Do not let the good appetite fool you. If your cat is over 10, leave a comment and tell me, has she had a T4 checked in the past year? I ask because the number of people who discover this condition after coming across that question is significant. It is a simple thing that makes a real difference. In the next video, I am covering kidney disease in cats, specifically why the early stage is almost completely silent and why by the time most owners notice something is wrong, roughly 75% of kidney function is already gone. That video could save your cat years of good life. Do not miss it. And if this video gave you something useful, something real that you will actually take to your vet, subscribe. That is the whole point of this channel. I am Dr. Amal. Look after your animals. They are counting on you.